My name is Dr. David Reznik. I'm Chief of Dental Medicine at Grady Health System. I would like to answer some of the questions that have come in. So let's go ahead and get started. Are the current disinfectant wipes that we're being used or in the dental setting, are they effective in killing COVID-19? And the answer is, for the most part, yes. This doesn't take a special kind of wipe to kill it. It's a lipid coat on the virus. It's very easy to kill using alcohol-based or any of the kinds of EPA-approved disinfectants that you have. Again, just read the label and follow the instructions on the label. So yes, for the most part, our dental wipes are effective in killing COVID-19. Other questions include waterline safety, and to me this is a really big issue because many of our offices are basically down. We're not working, or we're only seeing emergencies, and we have operatories where there is still water and we're not using those operatories. So waterline safety protocols must be maintained even during a period when we're not using the operatories because you have standalone water. So flush your water lines every day, your high speed, your air water syringes, follow all of your manufacturer instructions for things that you've done in the past to make sure you're meeting the CDC recommendations of less than 500 parts per million. So there's definitely things that you should be doing. Don't stop your regular infection control procedures just because we're in this moment of crisis. Continue to do what you were doing before. I hope that helps. A question came in about, is there other things that our front office people can do besides throwing away magazines and keeping hand sanitizer at the front desk to maintain health? Our front desk is our first point of contact for our patients and in many ways is the face of the practice. And so it's really important that, like all members of the team, we do everything possible to ensure their health and well-being. So pre-visit screening calls. Have you been running a fever? Have you been short of breath, having a difficulty time breathing? Are you having a dry cough? Have you recently lost your ability to smell and taste food? Do you have recent onset aches and pains? Do you have recent onset GI distress? And with all of the stress that's going on in our environment today, I think a lot of people are going to answer some of these questions positively. We're in a very stressful environment right now. And so we want to do what we can to minimize the stress and bring back, I guess, a little bit of joy into our world. So you can do those front desk calls. You can mask our front desk, which we're doing here. We're eliminating as much patient and card transfer as possible so you don't constantly handle things. And if the front desk person is more comfortable wearing gloves, then let them wear gloves. The whole idea is you want to create a safe environment for each and every person that walks through your front door. Okay, here, let's talk about a scenario that is going to be a difficult scenario. You have an employee and they test positive. What do you do? And I think this is where emotional intelligence becomes a key component. When somebody would come with me that kind of news, you know that they're frightened, they're scared. They may have an underlying condition. It could be hypertension, they could be a diabetic, and they're even more anxious. So it's really good to try to use emotional intelligence and express sympathy for this person that's working with you to make your practice a success. They're going to be anxious what might happen to themselves or to their family. They might worry about spreading it around. And so please let the employee or your teammate talk. Sometimes it's just best to listen as opposed to carry on. Minimally, you're going to have to ask the employee which coworkers they've been in close contact with because we're going to have to arrange testing. And we're looking at a period of 2 weeks, so who have they been around for a couple weeks? The CDC's definition of close contact is a person who has been within 6 feet of the infected employee for a prolonged period of time. Of the utmost importance is respect the confidentiality of both the positive tested employee and anyone in close contact. I think that is also very important. Staff and patients who have tested positive can return to work and or receive emergency dental care. So here I'm talking about staff who may have tested positive and a patient who may have tested positive. But they have to complete home isolation clearance. And this is another question that comes up. So what are these key issues? At least 3 days or 72 hours have passed since recovery. So resolution of a fever without use of a fever-reducing medication such as acetaminophen, and improvement in respiratory symptoms. So cough is going away, no more shortness of breath. And at least 7 days have passed since the symptoms first occurred. So let's go over that. At least 3 days have passed since recovery. You're not taking anything for a fever and you don't have a fever and the other symptoms are going away, cough and shortness of breath. Or at least 7 days have passed since the first symptoms have occurred. Another option is for individuals with a laboratory confirmed COVID-19 test who have not had any symptoms. At least 7 days have passed since the date of that first positive diagnostic test and had no subsequent illness. So a key is 7 days having passed since symptoms, 7 days having passed since the diagnostic test was positive. And then if you do have somebody who was diagnosed, then it was at least 3 days since they've recovered since then. More questions that have come in, and some of these are debatable at the present time. One is there a pre-procedural mouth rinse to use that's going to reduce the amount of viral particles that are in the saliva? Now, the ADA is presently recommending a 1.5% solution of hydrogen peroxide. Hold in the mouth for 30 seconds. Give the patient a saliva ejector to get the excess, and then repeat. There are other studies looking at different materials in different parts of the world that have yet to be published or will soon be published, looking at other options. Some of the options that we're used to using as a pre-procedural wash, such as chlorhexidine like Perigard. We would do that before we take out teeth generally. We do that before crown and bridge on occasions. That is not effective in reducing the COVID viral load. So right now the ADA does have that recommendation. I would keep my eyes open. There will be new news coming, I would say, in the relatively short future, where we'll find other options to rinse with outside of this. There's a question on masking, or do the different types of masks provide like level 1, 2, or 3, and those are your surgical masks. Do they provide enough protection for the dentist, or is an N95 needed? So if you've listened to me any of these weeks, you know that I'm a big proponent of following the CDC guidelines, which recommend using an N95. The level 3 face masks are excellent fluid protection. They're the best out there as far as a fluid barrier goes, but they don't get down to the less than 5 microns, which is really what an N95 can do. And so N95s actually have to filter out 95% of airborne particles of the most penetrating size, and here that's 3 microns, 0.3 microns. So as you can see, one is really good for fluid, that is your typical surgical mask, and one is really good for air particles and airborne particles, and that is your N95. They can be used in combination, but only not to give you more safety or make you feel better, but only to protect your N95 mask. Some more questions that have come in are about potential changes to infection control in the office following this pandemic. How will this change impact us once we return to work and we're there full time? As we know, this pandemic might peak and valley, but until there is a vaccine, it's most likely going to be with us for a while. And so how can we do what we spend our lives training to do, what we spend our lives performing by eliminating pain and infection and restoring function and aesthetics for so many people that dentistry serves. The benefits of our profession are really go without saying. You can't be healthy without without oral health. So it's sticking with all of these lines. What are we going to have that maybe is different? Well, once we get past this shortage of N95s, my first recommendation is that all offices, all dental offices, have all staff fit tested for N95 masks. So it's a really simple process. You put the mask on, they put you in a little bit of a head container kind of thing, and you can breathe through it, there's no issue. And then they spray something, and if you can smell it, that basically means that it's not working, it's not fit tested. So all of these masks should be fit tested, just don't buy the mask. You want to make sure you have a great seal, because you don't want any of the particles coming in around the mask. Per usual, we need to make sure that all PPE is available. So goggles are available for each and every staff member. And remember, some of these things, even in our nicest facilities in North America, sometimes walk out. So make sure you keep your valuable PPE, such as your goggles, in a place that's only available that you can get to. Will there be engineering controls? Are we going to be looking at air exchange rates like we have in operating rooms? Are we going to be looking at negative pressure rooms because we're concerned about air transmission of pathogens? So there are a lot of research that needs to be done. COVID-19 is going to be around for a while. We need to take every step imaginable to protect the safety of our team, to protect the safety of those that we serve, because they're our primary responsibility. It's the health and well-being of those that we work with and those we try to help take care of. And always remember the importance, first, do no harm. So all of your things that we're doing now, hand washing 20 seconds, several times a day, avoiding hand contact. Some of these things might be around for a while, and we're going to have to change the way we do business. But how we do that doesn't necessarily mean it's a bad thing. It's just how we deal with our present circumstance and move forward. Thank you for your time and attendance, and I look forward to joining you soon.